أعوذ بالله من الشيطان اللعين الرجيم بسم الله الرحمن الرحيم اللهم صل على محمد وآل محمد وعجل فرجهم. Today we are going to discuss foot and mouth disease, that is an acute infectious disease of cloven-footed animals of both wild and domestic animals, which include cattle, buffalo, sheep, goat, pigs, swine, and other wild animals as well. They are included. Elephants, they are also infected with this foot and mouth disease virus. There are 7 serotypes of foot and mouth disease virus, including serotype A, O, Asia 1, C, SAT1, SAT2, and SAT3. SAT is actually South African Territory 1, South African Territory 2, and South African Territory 3. So far as the symptoms of foot and mouth disease is concerned, they include very high temperature of up to 105, more than 104 degree Fahrenheit, lameness, and animal is unable to eat, unable to chew. When there are formation of blisters in mouth, animal is unable to chew. There is excessive salivation as well, and when blisters they are formed on the hoof area, then animal is unable to walk, so lameness occurs. This disease must be differentiated from other lameness related problems like black quarter disease. In black quarter disease, there is lameness of one leg. Animal is unable to walk, but mostly hind quarter is affected, and mostly one leg of the hind quarter is affected. But in FMD, all 4 legs, they are fore quarter and hind quarter, both they are affected by FMD virus. Disease is more severe in cattle and buffalo, and it is less severe in sheep and goat. And in sheep and goat, disease is mostly oftenly it remained subclinical. Disease is not fatal in adult animals, but it is severely fatal in young calves. Up to 95% of the calves they are died due to the infection of foot and mouth disease. It is acute in case of young calves. When they suckle milk from the dam which is infected with FMD virus and FMD disease, that virus comes in milk, and when that milk is suckled by the young calf, that virus is introduced into the body of the young calf, and this virus affects the myocardium of the calf and death occurs. So these are the main symptoms of foot and mouth disease. So far as the treatment of foot and mouth disease is concerned, there should be topical application of some topical application of the antiseptics should be done, like permanganates can also be applied, but in mouth area, boric acid and glycerine has very great results, because that has a soothing effect on the blisters in the mouth area, because there are, in this case in foot and mouth disease, blisters are formed in mouth, on lips, on tongue area, on cheek area, buccal cavity, whole buccal cavity may also be involved, and blisters they are also formed in case of females on udder area, and in case of males on testes area. So in females there is reduction in milk production, that these are also the signs and symptoms related with FMD. In females, there is reduction in milk production, and in case of males they may be impotent, and there are problems in mating process when males suffer from FMD. We were talking about foot and mouth disease treatment. Topical applications, glycerin and boric acid should be applied on the vesicles in the mouth area, and potassium permanganate solution 0.05% should be applied on the hoof area. Fly repellents like phenyl, that should be also applied on hoof area, and also on those areas where blisters they are formed in other area, on teats or testes, depending upon the gender of the animal. Antibiotics should also be incorporated. Injectable antibiotics like penicillin should be used to prevent secondary bacterial infection, because in viral disease, as this FMD is viral disease, and due to viral disease, immunity of the animal that is reduced greatly, and when there is reduction in the immunity level of the animal, secondary bacterial infections may come in, and there are more chances of the other germs like bacteria and fungi, they may also attack on the animal, and other diseases may also occur. So to prevent all these problems, penicillin, procaine penicillin and benzyl penicillin combination should be injected to the animals for 3 to 5 days, for 2 times in the morning and evening as well. Furthermore, hard feeding like straw feeding, that should be avoided. All the fodder that should be lush green and soft fodder should be given to the animals, because if hard straw is given to the animal, that may be lethal, that may be more problematic for the animal, because vesicles they will rupture due to the hard lining of the straw. So there will be more pain to the animal, and animal will become more restless. So these precautions should be adopted, and control measures. So far as the control measures are concerned, first of all, proper vaccination should be done. Corporate vaccination, mass vaccination programs should be implemented, and 100% animals should be ensured having more than 3 months of age, that should be injected. And even now researches they emphasized that new researchers have emphasized that the animals, calves, cattle calves, buffalo calves, even sheep and goat calves, they should be injected at the age of 1.5 months. So all those animals which are having age of 1.5 months or more than that, they should be vaccinated properly. And if the vaccine is oil based, that should be given once per year. And if a vaccine is not oil based, and if it is alum precipitated and it is water based, means it is water based, then it should be injected for 2 times in a year. Vaccine should be done before monsoon season, and before monsoon season, preferably in March it should be incorporated, and after 6 months it should be incorporated. And other control measures include the restriction of the movement of the animal should be implemented, because suspected animals, the animals which are suspected with FMD, they should be restricted. They should not be allowed to move any to any area where animals are healthy, so that virus entry to the other farms and to other areas, that should be restricted, that should be prevented. Control measures, control strategy also included best biosecurity, uh, biosecurity steps that should be adopted. And biosecurity steps include the the cleaning of the equipments present at farm, cleaning with disinfectants, cleaning, proper cleaning of whole farm, equipments, vehicles, movement vehicles, and even workers, that should be done. And the worker, if the doctor is visiting one farm infected with FMD, that doctor should not visit the other healthy farm where animals are healthy. If he has to visit the other farm, then he should have a bath, and then after cleaning his whole body, he should enter the other healthy farms. There are so many other steps which can be adopted. Proper hygienic measures should be taken. Proper hygiene of the workers, proper hygiene of the whole farm should be adopted. This was a little bit about the foot and mouth disease, and we will inshallah present further more informations about foot and mouth disease. Thank you very much. Jazakallahu khaira. Allahumma salli ala Muhammadin wa ali Muhammad wa ajil farajahum.